structure that school provides is, and we've got young people doing homeschooling, which schools provide that space for young people and families and parents and carers to have time away from each other. It's a different environment, and we're not getting any of those things at the moment for young people. So, at a developmental perspective, it certainly is and will have an impact.
Now, you deal in this area day in, day out. Give us some advice that parents watching, grandparents watching, useful tips that they can use if they're worried about their primary school or high school aged child at home.
Yeah, certainly. I guess that as a mental health nurse, that's and I conducted a PhD looking at how to respond to young people in distress, and what we try and do through our programs with Equity Youth is really build the capacity of families, carers and professionals, educators and clinicians around how to respond to young people in distress. And if I was talking to parents, your listeners out there that are parents and family members or even professionals who work with young people, it's about knowing at the young person and the point at which they get where they're not coping in the moment, and we coach how to respond to a young person. Many people do get training, for example, on CPR or doctors ABC, and what we do is we coach our TAR3 framework, which is about the psychological first aid framework that any adult can use when a child is not able to cope themselves. And what's most important also is to identify when a child is coping and just holding back so that you give them that opportunity to build their own coping and resilience.
Dr. Stephen Spencer, thank you for those tips, and we appreciate your time.
Thank you very much. Thanks for having me on.